Hi everyone, it's Doreen Armstrong-Ross, President and CEO of the Drhc Regional Health Center, here today with an update for you, April 22nd, on the COVID-19 situation. Dryden remains with the 4 positive cases. All 4 of those cases are considered resolved at this time. Keep in mind that number could change at any time. We are testing daily and we are getting results back daily. You might be hearing things in the press around best case scenario and the flattened curve, and I just want to talk a little bit about those today. Ontario and Dryden and Drhc prepared for a certain amount of cases based on population, and we had posted something about that at the beginning of this. At the same time, the self-isolation, the quarantining, the measures that have kept us safe were being put out there, and everyone did a really good job of following those, and we are seeing the result of that. That is why we are in a best case scenario situation. We are still prepared and still ready for COVID-19 patients, and will continue to be so for an indefinite period of time. However, we are seeing that it worked. The isolation, the staying at home has worked, and we are not seeing those cases that we were in Ontario. Ontario had about 500 cases reported yesterday, not in this area. Certainly there is some hot spots in Ontario, and unfortunately what we're seeing is over 50% of the cases are in long-term care homes. There's a lot of work being done in the province to get on top of that and keep our elderly in those homes safe. We have done such a good job that what I really want to caution is it's not time to stop doing those things. They've worked they've worked. We're seeing decreased cases, but there's a reason for that, and it's because the isolation, the quarantining worked, and we really need to keep on. The virus is still very much in the province, as evidenced by the 500 new cases yesterday reported, and reported cases you also are about 2 weeks behind what is going on in the community. So it is very important that we continue with the self-isolation, the physical distancing, the hand hygiene, that sort of thing. I cannot stress that enough. That has kept our community safe, it has kept our elderly safe, and it will continue to do so. A few other things that I wanted to speak about is masks, and I actually brought some props here today just to explain to you how we're using masking in the hospital. And you might have seen people wearing masks in the community, and I just want to talk a bit about that. So in the hospital, all patient care staff and those seeing patients have access to these masks. These are what we call procedural type masks, and they are very commonly worn in hospitals, and I'm likely if you've been in a hospital you've seen somebody wearing them. So this is a mask that all patient care staff wear on a routine basis. This type of mask is an N95 mask, and this is a mask that staff wear when they are with a presumed or positive COVID-19 patient, and if they're doing different procedures, that sort of thing. Of course, there's a lot of other PPE that goes on to gowns, gloves, goggles, hair covering, that sort of thing. But this is a different type of mask, an N95 mask. And we have homemade masks, and thank you to whoever made this particular one. It's a very lovely fabric. But we did provide homemade masks to our staff that they can wear when they're in a meeting situation or working with coworkers where there's a few spaces, it's in a few situations it's difficult to physically distance. So these masks were provided. These are not PPE. The purpose of these masks is really to protect others from your secretions, what might be coming out of your nose and mouth when you breathe and when you talk. And that's really the general purpose for these. And something the medical officer of health of both Canada and Ontario and in other jurisdictions have suggested for keeping others safe. And it is sometimes a reminder too not to be touching your face and your mouth and nose, but it really is to keep others safe from any secretions you have. Any patient coming for a procedure or a appointment in the organization is screened on entry and then given one of two masks. If the patient has any sort of symptoms that are concerning in terms of COVID-19 or febrile illness, they're given one of the procedure masks. Any other patient that comes in is given one of these masks. Now, these are also something that was made by some volunteers and staff here, but these are what we're calling shop towel masks because that's what they're made of. So these are given to everybody else that comes into the organization that does not have any concerning symptoms, but again, just to protect others from any secretions from that person. So those are main four types of masks that we are using in Dryden Regional Health Center that you might see people wearing. The reason I'm just explaining that is just, again, to let you know, expect to put a mask on when you come in. Some people have come in with their own personal homemade masks on, and we're fine with that as long as you don't have any of those conditions going on that would justify you wearing a surgical mask. If you do have a homemade mask on, but you have a fever or you have a cough or runny nose, that type of thing, we'll be giving you one of these other types of masks to put on. Otherwise, if you don't, you're coming in for a different procedure, you have your homemade mask on, that's fine. And also, I just wanted you to know, if you see staff with different masks on, they're for very different reasons. And some are personal protective equipment, and then some are just recommended hygiene type things like the homemade masks. The other thing I want to mention, it's a very important week in terms of recognition. It's National Volunteer Week, and we certainly appreciate our volunteers. We're missing them. They're not in the organization right now, but we have volunteers working in so many different departments, our greeters at our desk that do such a good job of making sure everybody washes their hands when they come in and doing many other things for us in the organization. And we are missing them, but to keep them safe and ensure social distancing, we are not having volunteers in the org right now, but we have many new volunteers. We have the volunteers that of many types that we don't even know about, everybody that has made homemade masks and donated them to us, and volunteers that have brought things up for our staff. And we just really want to recognize that it is National Volunteer Week, and although we can't do anything physical for our volunteers because of everything that's going on, we wanted to recognize that. It's also Lab Week, and at the start of my talk, that's something I talked about a lot, was testing and the results of testing. So lab is very important, and it's you don't see them much unless you're getting some blood drawn. They're in their lab, but we certainly want to recognize their importance and thank them for all they're doing to help us during this COVID time, but all the other times. It's also Admin Professional Week, and really, even with the COVID-19 situation, we're all having to work in different ways. We're having to do meetings in different ways, and all of our admin professionals are having to do different things and helping us navigate these different waters and helping us set up Zoom meetings and OTN conferences and different things that we normally don't do as much when we're having face-to-face meetings. And a lot of them are working remotely and having to navigate that, and they're not here either, a lot of them. So We just wanted to take this opportunity to thank all the admin professionals that work here for us and for everything they do to help us get through this. We also want to take the opportunity to thank some of our other volunteer types, including our board of directors, our patient family advisory committees. Those are people who are very dedicated, spend a lot of hours helping us out here at the hospital in their governance and for the patient and family advisory committee, and helping us make sure that we're very patient-centered and family-centered, and that the things we do, the policies, the procedures, are all what will work for the patients and families. So we want to acknowledge them as well. So busy week, and normally we would have teas or cakes, and we're not doing any of that right now. So just a verbal thank you to everybody, and when we can, we'll certainly make up for all these times we're missing to celebrate each other. It's also a good time to mention the hospital and all the workers here, from our front line, our nurses, our physicians. I'm not going to name everybody because I don't want to forget everybody, but our people in engineering and housekeeping and dietary and in our shipping and receiving and stores departments. Everywhere in this organization, people have been stepping up, working out of their normal scope of work just to ensure that everything gets done, and we appreciate it so much. It's a really wonderful staff. This team has worked together and got some amazing things done in this last month and a bit since we've been in this pandemic situation, and I really want to acknowledge all of them and say thank you so much. We couldn't do it without all those departments: finance, medical records, DI, physio, OT, all of them. It's just very important. All the work everyone does is so very important to ensure that we can care for all our cases, or all our patients, and deal with anything that comes in. So I just want to acknowledge that, everybody, at this point too. That is really an update. I know this was a bit of a long one, but I did want to talk about those masks and give the acknowledgement to the staff that are working so hard to ensure that we're ready. And I thank you all, continually for the generous donations you made from the hospital, the notes, the cards. We've had some wonderful parades by the hospital, and food and snacks sent up here, and we just really appreciate the support from the community and the community groups that have stepped up and donated items and PPE, and we are very much appreciative. So take care, everyone. Stay the course. Stay home. We'll update you, and as things change, we'll definitely let everyone know what's going on, but we appreciate the sacrifices you have all made to ensure that we have protected people in Dryden and have kept our cases really to a minimum. That's really good work on your part, and the hospital and the workers here want to thank the community for that, for ensuring that we are not overrun and that you've kept yourselves and each other safe. So thank you very much. So take care, and we'll talk to you in a few more days likely. Thank you.